This is Viewpoint.
Welcome to Viewpoint. I'm Doug Petcash. Do you or someone you know have Medicaid for health insurance? A really big change is kicking in on April 1st that you need to know about. That's the date Medicaid coverage will end for many Idahoans, potentially tens of thousands of Idahoans and millions of Americans. Here's why this is happening. At the start of the pandemic in 2020, Congress passed a relief bill that blocked states from ending Medicaid benefits for people who were no longer eligible. Then, in December of 2022, Congress passed an omnibus spending bill that changed Medicaid enrollment rules. It says states can begin unenrolling people from Medicaid coverage starting April 1st. It's referred to as Medicaid unwinding. So on February 1st, the Idaho Department of Health and Welfare started sending notices to those whose coverage may be in jeopardy. Notices will be sent in waves on the first of the month through July. Those who receive a notice will need to complete the reevaluation process by calling the Health and Welfare Department or logging in to IdaLink. If you receive a notice, you have 60 days to complete the reevaluation before you could be removed. On April 1st, the Idaho Department of Health and Welfare will begin removing those who no longer qualify for Medicaid benefits. And right now, 450,000 Idahoans are enrolled in Medicaid. The department says up to 150,000 of those may no longer be eligible or have not been in contact with the Department of Health and Welfare during the public health emergency, the pandemic. The removals are expected to be completed by September. I know that's a lot to take in, so we're going to go over it in detail today. We'll recap what's happening, look at who this could affect, what to do if you get a notice, and what your options are if you are deemed ineligible for Medicaid benefits. My guests today are Dave Jepson, the director of the Idaho Department of Health and Welfare, and Pat Kelly, the executive director of Your Health Idaho, the state's health insurance exchange. Pat, Director Jepson, thanks for being here today.
Thanks for having us.
Glad to be here.
Let's start at the beginning, Director Jepson. First of all, why did Congress protect Medicaid back at the beginning of the pandemic?
That's a great question, Doug. And the short answer is that because the pandemic was happening, we weren't sure what all of the medical needs were going to be. The federal government, Congress, wanted to make sure that individuals had continuous coverage through that pandemic event so that if in case they got sick or were in the hospital, that they would have coverage. And so they passed a law that essentially created Medicaid protection, which said if you're on Medicaid, you get to stay on Medicaid until the end of the public health emergency.
Okay, so now as I mentioned, Congress has now passed the omnibus bill that allows states to start unenrolling on April 1st. So what is the Department of Health and Welfare doing right now in response to that?
That's a great question, Doug. What we're doing is starting the process of notifying, as you mentioned, approximately 150,000 Idahoans that they may no longer be eligible for Medicaid. That's going to happen over several months. We'll be processing or sending out about 30,000 notifications each month on the first of the month to let individuals know that they need to contact us so we can determine if they are still eligible for Medicaid or not.
And Pat, how does Your Health Idaho and Health and Welfare work kind of hand in hand at the beginning of this process?
So Your Health Idaho and the Department of Health and Welfare have been partners since really Your Health Idaho began in 2013. When a customer comes through DHW and does their evaluation, either as a new person to Medicaid or one of their other programs, or as part of this reevaluation process, they go through that process, and if they are deemed eligible for Medicaid, they stay with the Medicaid agency. If they might be eligible for a tax credit, we receive that information overnight via electronic transfer. And then we go through our rules engine and determine eligibility.
And are you seeing people already reaching out? Are your phones ringing more?
They are. In fact, we've seen about a 20% increase in that nightly transaction volume, which tells us that people are slowly starting to respond to those notices. When that happens, they then have an account created with us. We encourage them to complete their application, work with an agent or broker, and then get enrolled in a plan.
Let's emphasize that too, Director Jepson. What do people need to do if they get that notice?
Well, the first thing is need to respond to that notice. They can call us. The easiest number to remember is 211, or you can call the departments directly. They can go online to idalink.idaho.gov, and they need to start the process of completing their redetermination, determining if they're still eligible. They need to do that within 60 days of when we mail them. So we mailed out 30,000 on February 1st. Those individuals have 60 days to get back to us to respond.
And do you recommend that they do it sooner rather than later?
I would strongly recommend that they do that sooner than later. We want to make sure we can find out if they're eligible or not. And if they're not eligible, as Director Kelly just said, we pass them off to Your Health Idaho to see if they're eligible for health insurance benefit. One of the goals we have is that individuals have continuous coverage. So if they're no longer eligible for Medicaid, we want to make sure that we get them over to YHI literally the next day, so we can start processing to see if they qualify for coverage on the exchange.
And Pat, do you worry that people just won't follow through? They won't do the reevaluation?
Well, that's actually, I think, collectively our biggest concern, is that people will either not open in their mail, not know they're up for reevaluation, and then maybe go see their provider, they need a prescription or they're not feeling well, and then find out that they don't have coverage. And that's kind of the worst case scenario, is that people are looking for care, they need to take care of their health, and all of a sudden they find out they're not eligible. So by starting the reevaluation process early and working with DHW to determine your eligibility, that minimizes that risk and ensures that there are no gaps in coverage.
How intensive is the process of filling out or giving the information needed for the reevaluation?
It's generally on average it takes about 45 minutes for someone to do that. Again, they can do it over the phone. They can call us and we'll just walk through it with them. They can come into one of our offices. We have 19 offices around the state, or they can go online to idalink.idaho.gov and do it online themselves. But generally, on average, it takes about 45 minutes to get through the application process. When we have people on the phone, we'll do everything possible to get them completed while they're on the phone. So, for example, if we need to verify some income, we'll actually put them on hold and call their employer right then to verify that their income at that location.
Oh, all right. I had a question and it just skipped my mind right now. As far as the reevaluation process goes, as people work through it, and if they don't do it at all, they'll just be dropped, right? And then.
Yeah, and that's actually our biggest concern, is that if people don't respond, the default decision is they will be dropped from Medicaid. And then we end up in a situation that Pat just mentioned, where they then go to the doctor, think they have coverage, and find out that they don't. If they find themselves in that situation, they should reach back out to us, and if they are still eligible, we can reinstate those Medicaid benefits. But our biggest concern is that people just don't respond. Our other big concern is that we don't have accurate contact information for these individuals. And so the other request we're making is, if you're on Medicaid, please call 211 or go to idalink.idaho.gov and update your contact information so we can make sure that these letters and texts and phone calls that we're doing get to the person.
And as I mentioned at the beginning too, it's people who may not be eligible, but also there are people that you haven't heard from since the beginning of the pandemic. How big of an issue is that?
Well, we're actually concerned about that population because we don't know if they've moved, or and we've tried to contact through the pandemic, but we haven't heard back. So we really are concerned about making sure we have accurate contact information so we can hear from them. So if they've moved or they have new phone number or anything like that, we're worried that we're not going to be able to reach them.
And though that 300,000 people are eligible.
Yes, Idaho is one of the few states in the country that has continued to do eligibility even though people cannot be removed. Many other states are having to go through their entire Medicaid participant list. For us, we know that 300,000 individuals are eligible. And if those individuals, we've actually sent them a letter saying, you don't need to worry, we know you're eligible, you're good for the next year. And so that leaves the 150,000 who we don't know, either because they haven't contacted us for the last couple of years, or our latest information would indicate they may not be eligible.
Okay, and so getting that information is absolutely the key at this point. And people should they just wait to see if they get a notice rather than calling and asking that question?
That's a great question. We are staggering that out so we can, from a capacity perspective, process through those 30,000 each month. And so we would suggest that you wait till you get a notice. That's our indication we're ready to do the reevaluation. However, if somebody just wants to make sure, they can call or walk in or go online anytime, and if they do so, we will process their application when they do so.
Okay, so that's what's happening right now, and we want to talk about what their options are, and we'll get more into that coming up in just a minute here. And one of the major options those who lose Medicaid coverage have is finding new coverage through the state health insurance exchange, Your Health Idaho. We'll explain what it offers and how you can get coverage through it, coming up next on Viewpoint.
Where will your new Chevy take you this year? Anywhere. Find new experiences find new roads. Get 2.99% financing for 5 years on all 2022 Silverado 1500 pickups, or current competitive owners get $3,000 total cash allowance on this Silverado with a 2.7-liter engine. See your Treasure Valley Chevy dealers today.
You can't believe everything you hear. Like George Washington never chopped down that old cherry tree. But you can believe in big savings during the extended President's Day Super Sale at Furniture Row. Right now, the more you buy, the more you save. Save $100 on every $1,000 you spend. Check out special purchases while they last. Plus, 4 years, no interest financing. Shop the largest selection at the lowest prices, guaranteed. But hurry, the extended President's Day Super Sale at Furniture Row ends soon.
Has your cable TV lost its spark? Do you suffer from the buffer? You deserve reliable TV without the hassle and the frustration. A+ Satellite is your premier local dish retailer, serving the Treasure Valley with reliable TV and real customer service for over 15 years. If you have Sparklight TV, switching to dish with A+ Satellite could save you over $700 a year. Stop in for a face-to-face with A+ Satellite at Fairview and Eagle, behind Krispy Kreme.
Join us on Idaho Today, Thursdays at 12:30 for HealthLink Idaho, a segment featuring educational topics on how to keep you and your family safe and healthy. HealthLink Idaho, Thursdays on Idaho Today, sponsored by the Idaho Department of Health and Welfare.
Oh yeah, dude, that doesn't look good.
I know what to do. I'm going to cashnetusa.com. I can apply in minutes, and if approved, I can have the money as soon as the same business day.
Go to cashnetusa.com to apply for the money you need.
Welcome back to Viewpoint. Today, we're focusing on pandemic health insurance protections likely ending for thousands of Idahoans on Medicaid. At the start of the pandemic in 2020, Congress passed a relief bill protecting people from losing their Medicaid coverage, even if they were no longer eligible. That protection ends for those people on April 1st. So what can you do if you lose coverage? Once again, my guests today are Dave Jepson, the director of the Idaho Department of Health and Welfare, and Pat Kelly, the executive director of Your Health Idaho. That's the state health insurance exchange. Director Jepson, first of all, you touched on it in the first segment, but when someone contacts you and you realize that they are no longer eligible, what do you tell them to do?
Oh, it's a great question. What we tell them is they're no longer eligible, but they may be eligible for insurance coverage through Your Health Idaho, which also offers a premium tax credit. From a process perspective, we send their record that night over to YHI and let them know that YHI will be reaching out, or they can reach out to YHI.
Okay, and then Pat, so how will Your Health Idaho help those people in that process? It could be a scary time, like, I need health insurance, what can I do?
Yeah, it can be really quite concerning for Idahoans wondering if they're going to be able to maintain coverage. So when we receive that data transfer, we immediately reach out to Idahoans to let them know we have your information. Please come on to our website, yourhealthidaho.org, complete your application, which will help us determine your tax credit. Mm-hmm. That application and tax credit process takes about 15 minutes. At that point, That's all, 15 minutes. You'll then know the amount of tax credit, and then you can shop for coverage. Mm-hmm. People may wonder, do I need documentation, or how do I prove that I had Medicaid? Well, Your Health Idaho and our carrier partners want to make this as easy as possible, particularly with so many of them potentially losing coverage. So we will allow people to, what we call self-attest, that they lost Medicaid coverage. And with that, we will open up an enrollment period, which lasts for 60 days from the date of their Medicaid end date. So for example, if someone loses Medicaid as of March 31st, they have until the end of May to enroll in a plan.
I was going to ask you that because open enrollment is typically in the fall. And so these are basically individual special open enrollment periods. That's right. So that losing Medicaid coverage would be considered a qualifying life event. And that opens up a 60-day enrollment period. While we can have and have agreed to have people self-attest to loss of Medicaid, please keep that discontinuation notice so that you can provide that in the case of an audit. We want to make sure that people have that paperwork. And you mentioned that people can get a tax credit. So who would qualify for that? So tax credits are based on your income, what your family composition is. Are you married? Do you have kids? And also where you live. Generally speaking, for a benchmark plan, and that's a mid-level silver plan, so think kind of middle of the road plan, no one will pay more than 8.5% of their
income for health insurance. So when you look at a single person versus married versus a family of four, those would be the examples where that tax credit moves according to that family composition.
Director Jepsen, are you starting, you mentioned that the first wave of those 30,000 notices went out on February 1st. Are you noticing that a lot of people are responding?
Yeah, so far we've had about 7,500 people respond based on our reach out. And we're finding about 55% of those are no longer eligible. And so those are the ones that we've sent over to YHI and let them know that they may have options on the on the exchange at Your Health Idaho.
But the percentage is that high?
Yes, we did actually choose to notify first those that we have some information, either because they're on other benefit or we see through tax data or Department of Labor data that they may be over income. So we are starting with those that we think are no longer eligible, and so that's why we think that's a little higher.
But 7,500 out of 30,000, you still got a long ways to go, and coming up on a month left for these people to respond.
And that's pretty typical. We always give a 60-day notice, and typically we see a little response in the first 30 days. We send a reminder notice at 30 days. We start calling and texting in those last 30 days. And just like most people may do with their taxes, it's kind of that last-minute rush we see people come in.
Yeah, and Pat, you were starting to touch on the plans, and you mentioned a silver plan. So Your Health Idaho does have the tiered system. It's is it silver, gold, or gold, silver, and bronze?
That's right, Doug. So there are three what we call metal tiers. We have bronze, silver, and gold. The easiest way for people to think about that is bronze is the cheapest to have, but more expensive to use, meaning copays and co-insurance. And gold is the most expensive to have and the least expensive to use, and silver's in the middle. What we find is that most people select a bronze plan. About 30%, or one in three Idahoans, pay $0 a month when they select a bronze plan based on that tax credit. We do see then maybe about 25% select silver, and then the rest are in a gold plan.
And how many people are getting their health insurance through YHI?
So we have about 94,000 Idahoans that used Your Health Idaho in the last open enrollment. We're one of 4 states that actually saw growth this year. And that's really a testament to the focus on our customer experience that we've really increased over the last year, and really in preparation for the end of protected Medicaid.
And for both of you, but I'll start with you, Director Jepsen. With this issue, what is the point that you really want to drive home for people who may be in jeopardy of losing their coverage?
2 points. One is please make sure that your contact information is accurate and up to date, and you can call 211 or go to idalink.idaho.gov to update that. And the second is when you receive your notification, both mail, text, and email, please respond so we can make sure we get an accurate decision for individuals.
And Pat?
Don't wait. Please do complete that reevaluation with the Department of Health and Welfare. If you are determined ineligible for Medicaid, work with Your Health Idaho, yourhealthidaho.org. Our application process takes about 15 minutes, and then you'll get a tax credit in real time, and you can select a plan. We also have about 900 certified agents and brokers all across the state. They're no cost to consumers, and they're the experts in health insurance. And you can find one on our website, yourhealthidaho.org, and click on Find Help.
Okay, and they're the experts that can help walk through the process.
Absolutely.
All right. We have a couple minutes left, Director Jepsen. I want to get an update on the overall Medicaid expansion issue right now. The legislature is reviewing it now 5 years after the voter initiative expanded Medicaid in Idaho. Where does that review process stand at this point?
That's a great question. Back in 2019, when Medicaid expansion went through as a voter initiative and then with legislative behind that, there was a requirement in statute that the Medicaid expansion program be reviewed before January 31st of this year by the Senate and House Health and Welfare Committees. To respond to that legislation, the House and Senate Health and Welfare Committees had a joint meeting where the department came in and gave an update on Medicaid expansion. We talked through who's on it, what benefit it's had to the state and to individuals, what the cost has been, those sorts of things. And then those two committees in committee then talked about Medicaid expansion, and then they each drafted a letter to their respective leadership in the House and the Senate with what they thought should happen with Medicaid expansion. I'm not going to be able to quote the letters exactly, but basically the letter said that we recommend that Medicaid expansion stay, but that there be further work done around cost containment.
How much more has it been costing than originally thought?
Well, that's a hard question to answer because we had this thing called the pandemic that
Right.
went right through
All
the
these
middle
people
of
we're
that.
talking about today who stayed on it.
And stayed on, exactly. But the current program is about $1 billion in total funds. Of that, about $67 million is state general funds. There's some dedicated and receipts. We get money back for things like pharmacy rebates and things like that. And about $860 million is federal funds.
Okay, so it is mostly a federally funded program at this point. But the legislature could end the expansion if they chose to do so, but it sounds like from those letters, the recommendation is to keep it.
Yes, that was the recommendation from those letters. There was a bill printed that would repeal Medicaid expansion, but it has not had a hearing since it was printed.
Okay, and so with those folks, I guess that's also kind of a wait and see period for them too. And how many are on? How many and now have Medicaid through expansion?
Medicaid expansion has about 146,000 Idahoans on it. That will change as we go through this unwinding, but today it's about 146,000.
Okay. Director Dave Jepson, Idaho Department of Health and Welfare, and Pat Kelly with Your Health Idaho. Thank you both for the information today. I mean, it's very valuable. A lot of big changes for some folks out there.
Thank you, Doug.
All right.
Thanks, Doug.
You are welcome. Well, still ahead on Viewpoint. He made amazing art using the simplest of supplies, magazine pages, soot, even his own spit. And James Castle did it all in his family home in Boise. How you can pay his wonderful works a visit, coming up.
Dear 2030, we look forward to seeing you. After our 160-point quality assurance inspection, we'll be Toyota certified used vehicles with 7-year, 100,000-mile limited powertrain warranties. Not to honk our own horns, but the best new cars make the best used cars. Yours, Toyota.
Get 4.99% APR for up to 60 months on a Toyota certified used Camry, Corolla, or RAV4. Find yours at toyotacertified.com. Toyota, let's go places.
There's a new victim of identity theft every 3 seconds. And checking your credit score or bank statements may not be enough to alert you. That's because identity threats appear in more places than you realize. Identity thieves can use your information to open loans, transfer home titles, even commit crimes.
Someone stole my information and tried to buy a car in my name.
LifeLock monitors for threats to your identity, including ones you may miss, and alerts you if there's an issue. And if you're a victim, your dedicated U.S.-based restoration specialist will work to fix it.
If something happens, you have somebody fighting for you.
All plans backed by LifeLock's $1 Million Protection Package, including reimbursement for stolen funds.
I know LifeLock has me covered.
LifeLock, identity theft protection starts here. Call the number on your screen or visit lifelock.com/25now and use promo code 25now to save 25% on your first year of identity theft protection. Enroll now.
All I do is win, 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 no matter what. All I do is win, win. Everybody hands go up. All I do is win, 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 no matter what. Got money on my mind.
For art historians and modern-day art aficionados, the mention of the name James Castle conjures an image of someone who made the most of what he had, and he didn't have much. Using whatever canvas he could find, sometimes pages from magazines or used envelopes, and the soot from wood stoves mixed with his own spit, James Castle created realistic renderings and abstract interpretations of the world around him. James Castle was born deaf in Garden Valley, Idaho, and was entirely self-taught in how he expressed himself through art. His family home, after they moved to Boise, is now a historic site and museum featuring his works. The latest exhibit, highlighted now by KTVB photojournalist Kevin Esslinger, is called Hearth and Home.
Who was James Castle?
He was an artist. He was born in Idaho in 1899, and he was born profoundly deaf. He spent his entire life drawing, and he used drawing as, I would say, a means of communication and also a way of exploring his inner and outer world. He's really well known for making work with soot and spit, which is actually the focus of the exhibition that we have up right now. I'm Kristen Hill. I'm the Cultural Sites Program Manager. This is an exhibition at the James Castle House called Hearth and Home. He would mix more spit with less soot to create sort of a thinner, almost ink wash that he would apply with like wadded up pieces of paper or fabric, kind of a toning effect. And then mixing more soot in to create a more opaque, almost charcoal-like effect. And he would use hand-sharpened sticks to apply, sort of like a little quill. Turns out that saliva is actually very archival, and in all likelihood, if he had tried to do his work with water instead, it wouldn't have lasted. You look around and realize almost all of the works that still exist today were made on this property. So this is works that were made on this property from, materials that his family was using when they lived here, made out of soot that was burned in the family's wood-burning stove from trees that grew on the property. It's pretty rare with museums that are showing an artist's work to be able to have this really defined physical connection as well. When I look at Castle's work, I just see this intense curiosity. I think of Castle as kind of like part artist, part scientist. He was always exploring, he was always experimenting. He taught himself linear perspective. I mean, if you look at this piece right here, this drawing of the house, it shows this incredible linear perspective, an understanding of perspective that I think is really challenging even when you're, taught. One thing I really love about this drawing is the inclusion of the power lines. You think about that as, this is a changing feature in his landscape. As he's living here, this is something that starts to show up. His depictions of people it's so interesting. It's really spans a pretty big variety. There's a little booklet of political candidates, and he has recreated them, and they have, very lifelike faces and features. And then he's pretty well known for making these little figures that have kind of square heads and are very blocky. They look like they're maybe combining objects with people. We could never say what was going on in Castle's head, why he did what he did, but it's fascinating to look around and just wonder. It's hard to get a real strong sense of how deep his work goes until you've been exposed to it quite a bit. I learn more every single time I look. It kind of just feels like the deeper you go, the more there is to learn.
The exhibit runs through the last Saturday in July. The museum is open Thursday through Saturday, 11 a.m. to 5 p.m. It's in the Collister neighborhood on Eugene Street, which is just off Castle Drive, appropriately. That's all of our time for this week's Viewpoint. Thank you so much for watching. I'm Doug Petcash. I'll see you tonight on the Sunday News at 5 and 10, and right back here next Sunday morning for another Viewpoint.